In this video, I'm going to teach you a step-by-step process on how to solve and get rid of Achilles tendonitis for good. Now, before we dive into some exact strategies that you can use to help get rid of this pain for good, we must first understand where the Achilles tendon is located, as well as go over a couple causes of why this problem might be happening to you now. The Achilles tendon attachment is going to be at the bottom of the heel, which is the calcaneus bone. It goes all the way up into the muscle belly of the calf. So if you're dealing with problems around this ankle behind the heel area, you're most likely dealing with probably problems in the calf muscles as well. Now, the most common reasons why physical therapists see this in the clinic is primarily because of lack of ankle mobility, which is ankle dorsiflexion, your ability to bring your foot up, as well as weakness in the calf muscles. So in today's video, we're going to show you how you can get out of pain by loosening up some of this tissue, restoring your ankle motion, as well as showing you exercises to improve the strength in your calf muscles. Now, one of the first ways that you can begin getting out of pain fast is by assessing and addressing the soft tissue around the ankle. Here we are targeting the calf muscles because, as mentioned earlier, we know that the Achilles tendon attaches to those calf muscles. So a lot of times we can get a great amount of relief if we start to just work on some soft tissue mobility around those muscles. So here you notice I have a foam roller and I'm just sitting upright with one of my legs on top of the foam roller. And the reason why I have the foam roller going perpendicular is now I'm able to really scrub and move those muscles over the foam roller. I can also use my hands and apply a little bit of pressure, and I'm simply finding those tender areas and I'm moving or rolling my leg in these small motions over the foam roller here. I don't have to go very hard for this to be effective. And usually you can hang out here for about 2 minutes or 3 minutes at a time. And the nice thing about it is not only are you focusing on rolling near the bottom of the Achilles tendon, but you also want to explore the upper calf muscle. You might have a lot of tight areas in that area that you really want to improve that muscle pliability and mobility. Now, one of the next ways that you can continue to focus on improving the tissue flexibility, as well as start to focus on your ankle mobility, is using tools like the Voodoo Floss. This is a fantastic tool that can really help with your Achilles tendonitis. And this is basically an elastic band that will apply a lot of compression on the joint, and then you can take that joint through some active range of motion. I have used this in the past in some of my previous videos because I think this works fantastic when you're addressing specific joints like the shoulder or the ankle, and even around the knee. They can do a lot of good there. And what I'm doing is applying about a 50% stretch as I'm wrapping this around my ankle like so. And I'm also going to take it a couple times around the foot and then start to work it around the ankle joint and then all the way up into the upper leg as well. Now, sometimes this gets a little difficult with trying to apply that compression and hold on to the end of that band, but notice I'm working my way all the way up where that Achilles tendon is, and that's going to feel really good because compression on a specific muscle tends to feel really good for people. And then once I lock that band in place and it's not moving, I'm feeling a lot of compression of that band. Now I can specifically take my ankle through some passive and active range of motion. So more specifically, we're talking about ankle dorsiflexion. So notice I'm taking my knee over the foot, trying to get that stretch behind the calf and the Achilles. And when you work on this, you can keep the band on for about 2 minutes at a time. And then after that, you'll go ahead and release it and then try again. Now, as you start getting out of pain, as well as starting to improve the ankle range of motion, it's going to be imperative that you are continuing to focus on stretches that will take your ankle through full range of motion. Now, static stretching, I think, gets a bad rep, but there is a lot of benefits to working on some static stretching. And the number one reason why I like this specifically is because you can really focus on the position that you're placing your ankle in. Now, this is going to be a traditional calf stretch, but I'm gonna show you specifically how many people can do this incorrectly. So when you're working on a calf stretch, the main thing you wanna focus on is if I'm addressing my left ankle here, I want something that I can create some leverage and push against. If I simply just put my leg behind me like that without leaning or pressing against anything, of course I feel stretch on the back calf, but it's not gonna feel nearly as intense if I'm actually leaning my body weight against something. This also allows me to try my best to keep my heel on the ground, which is going to be extremely important, because if you're stretching and most people are doing this, their heel comes off the ground, which is a big mistake that you are making. Another thing I want you to think about when you're practicing this stretch is that your hips being squared. A lot of the times when people are dealing with these conditions or any other problems in the foot, they tend to cheat by turning their foot outward as well as turning their hip outward. So what we want to do is actually bring that hip into internal rotation. You want to think about squaring up your hips, trying to keep the heel back on the ground, and now doing your best to keep that back knee nice and straight. Now creating leverage with the wall or whatever you're leaning on, now you're going to do your best by thinking about pushing forward, leaning your body weight forward, as well as trying your best to keep the heel down on the ground. If I do this correctly, I'm gonna feel a lot of stretch in the Achilles, as well as the upper calf, maybe even in the hamstrings if you have tightness there. And you can simply hold this stretch for about 30 to 60 seconds at a time. And you will also want to do the other side as well. Even though if you're just dealing with pain on one side, it's always good to balance out the other. Now from here, we have done the calf stretch with your knee straight. Now it's important that you also do the calf stretch with your knee bent, just so that we can address that second layer of the calf muscle. So what we're gonna do now is bring that same leg forward, and now using support of the wall or this rig here, you're now going to allow yourself to kind of sit down. Also notice I'm still keeping my foot straight. I'm also trying to keep my heel down on the ground, and now I'm gonna feel this behind the calf, which is going to be great for really trying to improve the length of that calf muscle. Now, if you've made it this far, I wanna say thank you so much. And if you found value in this video so far, please give this video a like and subscribe to the channel for more tips on how to take care of your body. Now, the last exercise that we're gonna get into is you can do all the ankle mobility exercises, you can do all the soft tissue work, all you want, but you're never going to address the issue for good if you're not working on strengthening. Now we're gonna focus on a very effective exercise that you can use that is definitely research-based and will help improve the strength in your calf muscles, as well as get rid of the pain in your Achilles. Now, what I'm going to do is you're gonna set up on a step or a stool, something where you can basically have your heels hanging off the back there. Notice I am also barefoot because when I have shoes on, this is very difficult to really feel a stretch in the right area. So I'd recommend doing this barefoot if you can. But basically, with both feet, you're gonna start by going up as high as you can. Notice both of my knees are straight, and then I'm gonna transfer my weight to one side and then slowly lower it back down. Okay, we call this an eccentric exercise, an eccentric load. We're controlling all the way at the bottom, but then as I come up, I'm using both legs to assist the motion up. The only time I'm really relying on that injured side or the left side that I'm focusing on is when I'm lowering down. Now you can obviously do this exercise holding on to a dumbbell to add some load to this, but when you're just starting off, you want to focus on body weight first to see what that feels like. And you might be dealing with a little bit of pain with this. That's totally okay. We're going to focus on about 3 sets and anywhere between 12 to 15 reps at a time. The important part is that slow lowering and trying your best to keep that knee straight. Now that is a step-by-step guide on which exercises you can be using at home to help heal yourself from this condition for good. Now, if you're someone that is dealing with this issue, you must also understand that the shoe wear and what you put on your feet is greatly important on how your foot interacts with the ground. If you want more information on which shoer I believe is the best for this specific condition, go ahead and take a look at this video up here. In the meantime, to support this channel, please give this video a like, subscribe below, and if there is a topic that you want me to cover, please list them in the comments box below. I'll see you in the next one.